So what is the most appropriate next step in the management of this patient's pregnancy? Amniocentesis, chronic villus sampling, fetal ultrasound, AFP, no further testing. Okay, so we have a 32-year-old woman, G2P1, is seen in the clinic for her first prenatal visit at 12 weeks. Firstborn had a limb malformation, was shortened, confused fingers, toes. She's concerned about the risk of similar malformation in her current pregnancy. Her family history is significant similar limb abnormalities. Genetic testing of the effect reveals a mutation in the gene for limb development. Okay. Well, limb development, it would be like FGF1 or something like that, I think. But anyway, if it's running in the family, you gotta genetically do a test. So I don't think you would do ultrasound or AFP. I mean, I know chorionic happens in 10 to 13 weeks, and then amniocentesis is 15 to 17 weeks. And so I don't know if you want it earlier or if like one of them's like the correct thing for diagnosing someone. So I'm just gonna say chorionic villus sampling.
Good. Yeah, so I think it just deals with, like you said, 10 to 13 weeks, right? Early just allows for early genetic analysis. And yeah, it deals with a genetic thing, right? And so if you really, really want it, then you're going to have the chorus villus, right? Amniocentesis, usually only 15 to 20 weeks gestation, right? And so obviously this is kind of testing you about your knowledge on the time frame for genetic testing for fetuses, right? So definitely that time frame super, super important, right? Fetal ultrasound, right, can be used for structural abnormalities, but not going to give you too much genetic information, obviously, as you already know. And AFP is only really good for neurotube defects, right? Not limb malformations. And then no further testing needed. Well, she kind of wants, it's in the family. She wants to know, and so this is a risk benefit thing. And so for the knowledge of the genetic mutation of this fetus, you can definitely offer it. But yeah, good.
I think if the question came from an angle of she took thalidomide and it wasn't running in the family, I don't think any further testing. It would just be like education on uh,
Exactly. Exactly. If you have some kind of inciting factor or, like that becomes a different conversation, right? So that's a good point. So for instance, give you an example, let's say, you had a really bad trauma, right? Like as in like car accident and then had a abortion because of that trauma. And then, mother is concerned with this baby, like, oh, do we have to do any testing for abortion? Then of course you would have to do the education standpoint and be like, oh, those are unlikely related, right? It's not a genetic thing. It's because of your trauma, things like that. So, that situation, obviously, they would give you that information, right?
Yeah.